Hello everyone, and let's take a minute to learn how to use our CPT book to code for radiology services. So again, let's start by looking at the radiology section and the guidelines. So if you open up the tabular for the radiology section, you'll see the guidelines, the radiology subsections, diagnostic radiology, diagnostic ultrasound, radiological guidance, breast mammographies, bone joint studies, radiation oncology, nuclear medicine. Then the following page has the different guidelines, the unlisted codes, when a special report is needed, what supervision and interpretation is. So again, make sure and read all of these and refresh on administration of contrast materials. Some radiology procedures like CAT scans and MRIs might use contrast, so you need to be aware of what those are. So make sure and read those. And then the radiology tabular actually starts. So it's the red pages in your CPT book. Just like the other sections in CPT, we look everything back in our index. We look it up. We look it up by the procedure being performed, which is the radiological test or service. And let's go ahead and practice a couple. So our first one, let's say our patient is coming in for a liver and spleen imaging with vascular flow. So what is our main term there? Well, it would be imaging, right? So if we go to imaging, go to I in our index to imaging. It tells us to see nuclear medicine. So now we're going to go to nuclear medicine. And then under nuclear medicine, we're going to go down till we can find liver. Right here, and we wanted the one with vascular flow. So we have two codes to look at, 78202 or 78216. So now let's go to the radiology tabular to 78202. Okay, 78202 says liver imaging with vascular flow. Well, that doesn't say anything about the spleen. So let's look at the other code, 78216, which is at the top of the next page. And it says liver and spleen imaging with vascular flow. Remember, when you see an indented code and then a semicolon, you replace the indented code with what's behind the semicolon. So code 78216 reads liver and spleen imaging with vascular flow. That's the correct code, so that's what we will assign. Let's practice one more. How about a patient who's coming in who had a car accident, and they are doing 3 x-rays or 3 views of the cervical spine. So we're going to go to our index and go to X-ray. X-ray of the cervical spine. So we're going to go to spine and then to cervical, and we have quite a lot here. 72040, 72050, 72052, 72081 through 72084. These are all the ranges you need to look at in the code. So pause the video for a minute, take a minute, look at all of these and see which one you think is correct. And then when you have the correct answer, unpause the video and I will go over the correct code. So hopefully you came up with 72040. That is the correct code. And if we look at the wording, it is radiological examination, spine, cervical, 2 or 3 views. Because we had 3 views, that is the correct code. Now I have one for you guys to do all by yourself. We are going to do a perinogram. So if you're not sure how that's spelled, it's P-E-R-I-N-E-O-G-R-A-M. So perinogram. Again, pause the video, take a minute, look up the radiology code for that, and then I'm going to go over the correct answer with you. Okay, hopefully you guys came up with code 47775. 74775 for perinogram. And the way you looked that up is we went to P in the index, to perineum, and then X-ray with contrast, and we get 74775.